Well, what we're going to do here is we have a cadaver dog, and I'm going to take the fear out of the joint injections. Just remind us of an easy technique to inject these joints with the stem cells. And once you follow this, you're going to agree with me. This is very, very easy. Couple things that I like to use. I like to use spinal needles when I'm doing hips. I don't necessarily need to use them on, say, a stifle or a carpus or a hock joint, but I do like the spinal needles on a hip. Just because we're going a little bit deeper, and I just feel we're going to get a little less contamination that way. Just a personal preference. You can decide for yourself. And I'll usually use anywhere from a 2.5 inch, depending on the size of the dog. This cadaver here, 2.5 inches would be fine. And I'll go as high as 3.5 inches on a large dog, maybe even 4 inches on a really giant breed dog. Don't need all of that, but it's just a little bit easier to manipulate and get into that joint. Okay, the first thing I like to do is when I get the needle out is I like to get the femur perpendicular to the spine. So feel the femur and just make sure it's perpendicular to the spine. Then I abduct that leg out. I manipulate it around. I'm feeling for the neck of that femur. I want to feel it. There's the major trochanter. I go a little bit cranial to it and a little bit dorsal, and you can feel it right there in the ball and socket joint. Then I have my assistant keep that knee in abduction because that opens up the joint for me. I point my finger like a laser down to the neck of the femur, and I put the spinal needle until I hit the neck. There's my landmark. I'm on the neck of that femur. Now I just walk it straight dorsally towards the spine, not caudally, dorsal, right towards the spine. Look at a skeleton if you have to. It really helps you out. You walk it, it will slip right into the joint. Even if you have a severely arthritic animal, you'll get under that joint capsule pretty easily because that capsule comes down over the neck of the femur. Now, when I go to the stifle, I think all of us know the patellar tendon is a pretty easy joint to hit. Just a few reminders. There's the patellar tendon. You have the femur. We have the tibia. You want to go at about a 90-degree angle to the patellar tendon. If you go too high, you're going to hit the fat pad, and it's going to feel like you're hitting bone. And if you go too low, you're going to hit the top of the tibia. So we just go 95-degree angle. Obviously, this would be surgically prepped. Very, very easy joint to hit. Either side, medial or laterally, it doesn't matter. Very, very easy joint to hit. Just go on either side of that patellar tendon. Feel your femur right there, and then you can feel the tibia crest. Go right in the middle, and just simple. I use a 22 1.5-inch needle, 22 gauge 1.5-inch needle. Now, when we go to the hock joint, when I do hock joints, there's always swelling. There's always a fusion there. So the easiest thing is to find the swelling and just go into the swelling. The joint communicates, so it makes it real easy. You can go into the front around the talus if you want. That's a very easy way. Lateral side, doesn't matter. You just don't want to hit a vessel around here. And then you can go on the medial side as well. And it doesn't matter. It really is easy on these hock joints to just find the swelling and go into the swelling. Otherwise, manipulate it around till you feel a little bit of a joint space, and then just put your needle directly into that joint space. It's a very, very easy joint to hit. It's very shallow. And I think that a lot of vets will probably tap those joints before anyways. Now, this elbow joint is another joint that strikes fear into people's hearts. I've been told that when I was doing a wet lab. And I found a different technique that I like to use. I like to go in on the outside of the elbow, on the lateral part of the olecranon. I find it's much easier to slip into the joint on this side. Occasionally, you're going to have some callus formation there, and you can just pull it out of the way when you're injecting it, which makes it pretty easy. The other approach would be the medial approach, and I can show you that too. Very simple approach into that joint. The shoulder joint is a joint that I would inject a lot, but it's a very, very easy joint. I consider this one as easy as the stifle joint. Right there, you feel the shoulder blade, the scapula, come down to the point of that shoulder, manipulate that humerus so you can feel that joint. You can almost stick your finger into it. It's a very, very easy joint to hit. You don't realize how big it is until you go to hit it. Don't have any fear from the shoulder joint. It's just as easy as the stifle joint, maybe even easier. You'll see when you manipulate around there, it's pretty easy to get into. Now, on the carpus joint, again, go for the swelling. Real easy to find. You can do it on the dorsal surface. I don't care where you do it. You can do it lateral. You can do it medially. I usually do it on the dorsal surface because that joint communicates as well. So if we get stem cells into that area, we've treated the whole area, and that's wonderful. As you can see, these joints are very easy to access. We just haven't done it in a long time, and you can practice on a cadaver dog, but it's very, very simple, and you'll find that these joints are a lot bigger than we thought. And again, all these joints communicate, so all we have to do is get into a space, maybe where the swelling is, which makes it even easier, and makes it a lot easier to get into these smaller joints.